Hello, my name is Lana and thank you very much for booking a laser hair removal treatment or consultation with me. So first of all, I would like to pass a few contraindications to the laser treatment. So you can't do laser treatment if you're pregnant, if you take in photosensitive medications, if you have taken Roaccutane, which is acne treatment, for the past 6 months, if you have cancer, if you have history of cancer, especially if it was a skin cancer, if you have epilepsy, if you suffer from lupus and melasma, so especially on the face, if you're using sunbeds frequently, and if you suffer from diabetes type 1, keloid scarring, not advisable to do when you're breastfeeding. We also need to take a GP letter if you have a controlled diabetes, if you have hormonal disorders, if you are very easily triggered by cold sores or herpes simplex, if you had peels in the area treated by laser, if you had a Botox or fillers in the area to be treated by laser, if you have extreme hyperpigmentation, if you're very easily sunburned, and if you had any pigmented lesions on the area to be treated, and excessively sensitive skin. Obviously, we test that on the patch test when you come to the clinic, but if you know in advance that your skin will be reacting to anything which touches it, then obviously we need a GP letter. So if you have very strong allergic reaction, obviously patch test will show that. If you have any other medical conditions, I need to know, so things to be discussed prior the consultation. If you're currently undergoing any medical treatment, so we just need to make sure that laser treatment could be done alongside that. If you have implanted medical devices in the area to be treated, so that's also very important to know. Thrombosis, any lung problems, any autoimmune disorders, and if you suffer from mental health condition, and if you have tattoos or permanent makeup on the area to be treated. Okay, so a few other things you need to know. How actually laser works. So in the area we're going to be treating, I will be running the laser and I'll be heating the hair follicles until the level when they pop. You will feel a pin and needle sensation in this area. That means the treatment progress very good. And obviously that will be quite a hot touch by the laser. Okay, there will be 1 second of discomfort, then it will calm down, and then you feel absolutely normal. I use a diode laser, which is used with a gel. So obviously if it's a face area, the makeup should not be worn on the day, or any sun protection before laser treatment shouldn't be worn on the day. I also use a cold air when we numb the surface of your skin with the gel, and then obviously treatment progress more comfortably for you. So the laser hair removal covers few things. We have different types of hair in our body. So the hair which is still attached to the follicle, to the capillary, which feeds the hair, and if we zap that on the day, that means the hair will go forever. The rest of the hair will also pop. They will fall out, but they will slowly find the way back to the surface. And obviously the hair have a hair cycle, so in order to grab that hair in the new cycle like that, we have you here regularly. For the body, it's every 6 weeks. For the face, every 4 weeks. If the laser treatment progresses very well and you don't have any hair growth during that time, before your next session there's nothing, that means we need to delay the laser visit, so by week, 2 weeks, until the hair comes back. Usually we start and advise to start with the 6 treatments on any area in order to cover most of the hair, and then after 6 treatments we review. If the hair is still quite persistent, we need to obviously continue with the same interval. If the hair is really hair growth responding very well and laser postponing the hair growth, then obviously we need to postpone your treatment as well. So is it painful? Yes, it is unpleasant. In order to achieve really good results, I need to have quite high settings. However, I'll be working within your comfort zone. If you won't be able to take the high laser settings, we can work on comfortable laser settings, but it can add the number of treatments. So the first 6 sessions will be predominantly with interval 6 weeks on the body. Then we have a 7th session, then it will be 8 weeks or 10 weeks interval. Then 8th session, that could be 10 to 12 week interval, because laser does slow hair growth enormously. And this is how we stretch the laser treatments through the course of few years. So some people responding faster to the treatment, some people responding slower, so we obviously play by the situation on the day. Okay, I always available for a chat to discuss the treatment, and we obviously can discuss what will be the best thing for you to do after certain treatment. So the hair areas which is performing the best, usually legs, usually maybe tummy line, and the some bikini areas and the top of the bikini areas. Laser areas which perform not so well and do need more sometimes than 10-12 treatments is lips on the bikini line, and obviously if you have a hormonal disorders, if you're going through the menopause and you have started to have hair on the chin, upper lip, so this is sometimes require quite a frequent visits. Even the ladies who removed the hair that they came with in the first place, after a certain amount of time they notice new coarse hair growing back. This is your body production, this is what your body gives, the new hair growth. So that's why this is basically sometimes a regular frequent visits to the clinic, but you could be rest assured the laser is the cheapest in the long run and the most effective hair removal offer, and obviously in many occasions gives a permanent results. You are left with fewer hair than you came with, and obviously get a nice and smooth skin. Thank you.